So we are moving now to our speakers, Dr. Marsela Ceno. The floor is yours.
Thank you very much, Dr. Neshat, for your invitation. I want to say hello to all my colleagues attending this session. I'm very glad to be part of this international conference, and it's a privilege for me to talk about this topic. I have prepared a small PowerPoint presentation. If it's possible, we can share the desktop. So thank you once again to everyone who is participating in this international virtual conference. We talk about the latest trends in digital health, and my name is Marsela Ceno. I am a general surgeon, abdominal surgeon, working in at the university clinic in Düsseldorf in Germany. I was born and in Albania, in a small town in southeast from this country. I studied in Albania in Tirana medicine, and after my 6 years of studies of general medicine, I came to Germany to have the possibility to absorb a very good specialization in the topic of general and surgeon abdominal surgery, and having or looking facing the problem of the medical immigration from countries such like Albania, Kosovo, and North Macedonia, we realized that in a very short time after I came to Germany, nearly 1,000 new doctors left the country in Albania and Kosovo and came to Germany to benefit from the advantages that the medical system offered in Germany, comparing to the situation that we had in our home countries. So this is a view of the university clinic where I'm working right now as an abdominal and surgeon. We used to perform a lot of laparoscopic operations, and surely we are in touch with the trends and some innovation of the digital health right now. So what is the purpose? What is the main of the digital health? The purpose and the main of the digital health is to transform the future of healthcare through digitalization. And the goal is to empower with innovative ways to collect, pool, and analyze high quality data from which we can extract actionable insights. And through artificial intelligence and digital trends in healthcare, we can use these insights to create efficiencies that improve patient care while reducing or streamlining healthcare costs. And how the digitalization will shape the future of the healthcare. The first step is through the reduction of hospital costs due to frequent rehospitalizations. Then secondly, reduction of long waiting lists for timely complex procedures such as echography or laparoscopy, more efficient use of hospital staff and hospital resources, people and management, especially in pandemic times like the time we are living at in the COVID pandemic, creation of decision support tools to improve the patient and physician experience, since satisfied personnel is of the highest importance to a long-term solution in any industry. And the digital future of the surgery is an inevitable tsunami of change. And the big question is how to bring the innovation of medicine, biotechnology, and computer science into the operating room. So we are talking about a phenomenon that is called the convergence. This is a picture I took in November 2019 as I was invited to attend a workshop in Minneapolis in the United States from a medical firma, and we were presented with a hologram that was a perfect human body, and just like walking on a tablet or smartphone, only with a touch you can go to the different layers of this human body and make an excellent presentation of the body anatomy, which is very interesting and very sufficient for the young medical students and for the young medical surgeons. So the digital future of surgery, as a colleague already told in the last presentation, embrace wearable devices, artificial intelligence, augmented reality, and the 3D printings. This is our future, and not only future, but also in some developed countries like the United States, or so German and France and Belgium in Europe. Even more operations are taking place with robotic. As you can see in this picture, the surgeon is sitting on the left side of the picture, and with some robotic arms, he is performing a laparoscopic surgery. And this idea of the robotic surgery was developed from some surgeon from the States who were performing in the Far East, and due to the humanitarian crisis and the war, they were not able to operate the victims of the war, like soldiers or other people in this country. So they developed the possibility to operate them from home. So the first operation in a digital way due to robotic surgery was performed in the United States, and the patient lied on the operation table in Afghanistan. And nowadays, this operation is performing more and more from the urologist, but even though from the abdominal and surgeons. So it is very easy to perform this operation for the surgeon. You can stay at your office, you can stay at your home and perform the operation with very high results as a just normal operation done by yourself with the hands. And other wearable devices are the glasses, the Google glasses, for example. They are technically fancy devices. They can be achievable, and they can be controlled with smartphones. And you can see the surgeon at the operation room can control through these glasses the vital parameters of the patient. And we can also, you have the possibility to make a live streaming of this operation all over the world. So you can scroll the CT scan of the patient through these glasses, and at the same time you can teach your student how to solve the wound or to perform the operation. And the Google Glass enters operating room at Stanford for the first time, as you can see at the other picture, the US doctor performs first live Google Glass surgery, and the benefit of this technique is that the countries like in Africa or in India, where the possibility to achieve a very good specialization in surgery is very low, you can share your experience, and you can stand by the other operation technique, and you can learn your students and your residents how to perform exactly an operation technique. So we are talking also about the artificial intelligence, and I have choose some pictures from the operating room. As you can see at the right side of the monitor, the first surgical sponge. So performing a big abdominal surgery means losing a lot of blood, and it is very important for the surgeon and anesthetist to know how much blood the patient have lost, so that we can make this substitution. And we have some methods to calculate the quantity of the missing blood. But as you can see, you can just open the napkin, and you can stand in front of a camera, and it can analyze automatically the quantity of the blood. And at the same time, the container of the blood, you can scan the barcode, and you can analyze the quantity that the patient is needing right at the moment. And if we're talking about the 3D printings, there is a lot to talk about. The science knows no limits, and as you can see, there are been printed 3D skull and they have been put it on the human body. And also we have 3D printers for the anatomy education, which is a very big opportunity to approach and to have very good knowledge in the abdominal anatomy. And we can have also parts of our body printed in 3D printer, like this jaw. And if you want to summarize everything that the digitalization, or how the digitalization will shape the future of the healthcare, these are the main points. So improving the diagnosis, more convenient delivery, then advancing personalized care, advancing access to healthcare services, improving drugs discovery and clinical development, and improving financial outcomes and increasing value, streamlining healthcare services and driving operational effectiveness. And this is the situation actually in Germany about the changes that Germany make according to the digital health solution. So since 2020, there are new German regulations that positively impact market opportunities for digital health companies. So due to this new law, the doctors are allowed to prescribe medical apps to improve access, or the patient access for the data research is improved. This kind of patient communication and prescription is moved to electronic channels. Every insured member can have access to an electronic health record, and pharmacies and hospitals are forced to connect to a secure communication network, and telehealth consultations become the norm. And health innovation is financially supported by circa 200 million euro, and health insurers will be allowed to offer online member sign-ups. Altogether, according to the new data and the new era that we have been through this COVID pandemic, we can say that the innovation of the digital health cannot be stopped anymore. So the COVID pandemic was a challenge, was a big possibility to develop other ways of being in contact with the patient. And therefore, I want to thank Dr. Neshat that making me part of his digital clinic in Pristina, and having the possibility to share my experience and to help people who are indeed, or patients who are indeed in Kosovo, and otherwise they can't have the possibility to get good treatment and efficient solution for their health problems. So I want to thank you again for this possibility, and if there is any question, I'm like to answer it at the end of this panel. Thank you very much.